Obesity thrives in Kenya when fast food outpaces running from lions. The potbelly is no longer prosperity. It's a quiet emergency. You're not overweight. You're oversucceeded.
The belly of the beast, obesity, status, and the silent health crisis in Kenya. Good evening, thinkers and overthinkers. Tonight, we head to Kenya, land of innovation, rich culture, and apparently the belly that launched 1,000 status updates. Yes, in case you didn't know, in parts of Kenya, a big belly doesn't just mean you skipped leg day. It means you've arrived. It's prestige. It's political power. It's generational wealth hanging over your belt. For decades, a prominent stomach has been seen as a symbol of prosperity, a visual flex, a body language bank statement. You're not overweight. You're oversucceeded. But here's the plot twist no one ordered. What once signaled survival now signals something else entirely. According to the 2025 World Obesity Atlas, 13% of Kenyan adults are now clinically obese. That's over 4.5 million people, and growing quite literally. And in a nation where nearly a third of the population struggles with food insecurity, the optics are more than just ironic. They're medically catastrophic. We're not just talking about soft life aesthetics. We're talking diabetes, hypertension, heart disease, and yes, early death, slow and silent, while society still cheers your circumference. Let's break this down. From stomach to status symbol. Historically, many African societies, Kenya included, viewed thinness as a sign of hardship, illness, or in more recent times even HIV. Being skinny, especially as a man, was a PR problem. Meanwhile, the full-bodied man was a Baba wa Taifa, a father of the nation. He had cows, he had land, he had snacks. He was the snack. This mindset filtered through generations. Politicians, businessmen, and respected elders flaunted not just their cars or cash, but their cholesterol. But times have changed. Globalization brought Wi-Fi, Uber Eats, and an obsession with image, but it also brought chips mwitu, soda na mandazi, and a sedentary lifestyle glued to screens and motorbikes. The result? A clash between cultural pride and modern health realities. The health receipts are in. Let's talk numbers. According to the Kenya Stepwise Survey and the World Health Organization, non-communicable diseases, especially obesity-linked ones, are now leading causes of death in Kenya. Diabetes rates are spiking. Hypertension is creeping into communities where blood pressure wasn't even in the vocabulary. And what's worse, it's affecting younger generations. Children raised in urban areas, bombarded by fast food and TikTok, are now the frontline casualties of poor diets and zero physical activity. They don't walk to school, they Uber to sugar, they're not playing football, they're playing Candy Crush with candy, and it's not just about personal choices, it's about systems. There's limited access to healthy food, poor regulation of sugary products, and minimal public education on nutrition. And that, dear viewers, is how cultural reverence turns into a public health crisis. Government wakes up, kind of. The Kenyan government, to its credit, is starting to act. President William Ruto, whose own fitness and slim frame have sparked debates, has endorsed healthy lifestyle initiatives. Ministries are launching Afya ni Mali, Health is Wealth campaigns. Fitness influencers are being partnered with public health officials. And for once, gyms are no longer viewed as places only Nairobi's soft boys and slay queens frequent. There are efforts to ban misleading food ads targeting children, require clearer food labeling, and implement sugar taxes. But progress is slow, and often limited to urban centres. Meanwhile, in rural and peri-urban communities, the potbelly still reigns supreme, quietly spreading like a badge of honour, with side effects no one talks about. Duality on the continent. And now let's zoom out, because this isn't just a Kenyan problem. Across the continent, Africa's middle class is growing, and with it, westernized food habits, processed imports, and a dangerous association of wealth with inactivity. According to the WHO, obesity in Africa is a ticking time bomb. It's growing faster than in any other continent, particularly among women who also face cultural expectations to maintain fuller figures as a sign of fertility or marital success. So what we're seeing is a double crisis. 1/3 of the continent starves, another third slowly eats itself to death, and in between we have a cultural tug-of-war between survival, pride, and modernity. Time to rethink bigger blessed, or it's time to shift the narrative. Health is not the enemy of heritage. You can love tradition without romanticizing slow death. Being big should not be shamed, but it should not be idealized at the expense of survival either. We need to teach that fitness is not Western, that nutrition is not elitist, and that your legacy should be measured in wisdom, not waistlines. Because let's be real, you can't lead the village if your heart gives out in your 40s. You can't build a nation from a hospital bed, and you definitely can't call yourself wealthy if your health is bankrupt. So here's the takeaway. Culture evolves, and the most powerful flex moving forward: longevity, energy, clarity, not gout. Let's invest in better food, better education, and better beliefs, because the next generation deserves to inherit strength, not just stories of how we praise the potbelly while ignoring the pain behind it. This is Nubian Narrator News, and tonight's moral is simple. Don't let tradition kill you slowly. A healthy future is a wealthy one. Stay tuned for a quick message from our sponsors.
Rent a vibe. Don't fix your life. Just rent the illusion of stability. Now available in precarious stamped 1619.